glad to be here today to talk about PreventCare's mission. I think it was incredibly important and an incredible honor that I was asked, hey, do you want to present this? Do you want to present this topic? Do you want to talk about PreventCare's mission? So, although the topic is AI utilization, I decided to put the title slide as the title of our white paper because we have been working with HITLAB over the past couple months for verification and validation, which of course is one of the most important parts of any startup. You obviously want someone to say, hey, this actually works, instead of, hey, market product, no, not fit. So bridging remote monitoring and clinical decision making, of which, of course, we include AI utilization in order to help providers and patients. So why do current remote monitoring solutions fall short? Let's talk about this for a second. You're in a hospital or you're in an outpatient setting or a clinic setting, and you get maybe some remote monitoring solution. It's big, it's bulky, and it really doesn't do a lot of what you want to do. Either you have to go into the clinic or you have to go into the hospital to get these measurements done, and it just, in general, doesn't provide the same amount of diagnostic care. So, again, delayed diagnostics. Going into the hospital, finding out, oh, over a period of time, you were developing this condition. You had no idea because you only came in, a couple times a month. Poor chronic disease management. This speaks for itself. You got a chronic illness. You need to be on top of it. You need to know whether or not you are getting worse or positively getting better. Preventable hospitalizations, again with those two things. You find out months in advance, hey, you've had this horrible chronic condition. You wake up, you're in an ambulance. That is, personally, unacceptable in this day and age where we have remote monitoring solutions. Slower decision making. Obviously, no decisions are done if you don't know you have anything wrong with you. And reduced care continuity. This all ties in together. This is why this is so, so important. So, the limitations, fragmented health monitoring, it's administrative burden, any EHR really dealing with the clunkiness and administration. Again, delayed awareness, health deterioration, overdependence on in-person visits. Like you gotta do telehealth or you gotta go into the doctor and you don't always have the time for it. So many people don't go to the doctor because they just don't have the time or, obviously don't have the money. It's harder and harder and harder nowadays to even go to the doctor and even to get an appointment. So, and of course, talking about gaps in underserved areas, you're not in the New York area, you're out in the middle of nowhere, good luck getting a doctor. That wait time, that wait list, that's going to be months before you see anyone. And I can speak on that as growing up in the Midwest and experiencing that myself. So now today, there are proactive health assistants designed to assist, but not replace doctors. Now you hear the whole AI spiel of, oh, AI is going to do all the diagnostics, it's going to make all the decisions, but time and time again, we've seen that can't be true. That can't be true because doctors spend decades in their fields. I think it's like 8 years, not counting residency, to even become a doctor, becoming a nurse, becoming a clinician. That experience matters. That experience matters, and we cannot dismiss that for any AI-related solutions. But we have to admit that AI can help providers. It can cut through the noise. It can cut through the different problems that are often shown. So let's see. From medical device to a smartwatch. You know how many people I saw wearing this watch while I walked in? And I know this is a digital health conference, but I'm seeing it on the subway. I am seeing it in person. I'm going to all these different events, even out walking in Times Square. You're seeing people wearing a smartwatch that has, again, 10 years ago, the features of a medical device. Things have changed so rapidly. It's incredibly impressive. It started out as, I want to track fitness. I want to track fitness. I want to track, general health, well-being, all that stuff. It was a nice to have. And then sleep and stress management. Now it can track sleep. Now it can track HRV. It can do a lot of these things and do a lot of these measurements where you're like, I didn't even know this. And then gone into chronic conditioning monitoring and even fall detection. I swear, putting on a watch and it detecting whether or not you fall, that saves lives right off the bat. So, these smartwatches, because they've been such an integral part of everyday life, we now have a very large segment of the population having a continuous monitoring solution. So, and digital-first prevention models, so many people, 62%, use wearable devices for health and fitness tracking globally. So over the entire world, that is a market segment we cannot afford to ignore. If someone is getting this sort of health watch, someone's getting a smartwatch and it's or Oura Ring, it's giving this information, this is something we need to tap into, and people have. But for preventative care, this is something that is important. So right now what we're doing is Preventare. It is a digital health platform that connects wearable data from an Apple Watch or a Ring, all that stuff, to patients and then to providers. So it's both an app and a patient portal for the providers too. So again, this is new to me because I was part of the Android ecosystem for forever, but iOS, I opened up the Apple Health app and I was like, oh my God, it's giving me so much information, I don't even know what to think. Immediately, it started stressing me out. I was like, I don't know if any of these metrics are telling me I'm going to die. And that's obviously an issue. Right? You open up an app designed to help you and monitor you, and you're like, oh my God, just buy me a casket now. But it's something where there are apps that already do this too. You need, an insight into what these values mean. You need an insight because when you're just presented with this raw data, it doesn't get to the heart of the issue. It doesn't give you sort of an explanation of a baseline monitoring system. It's just all this raw data and you really just don't know. So that's what the app version of Preventare does. It takes all that data and gives you priority insights. So it can tell you, instead of showing you all this data and information that Apple Health will give you, it says, oh, well, you know what? You actually got an excellent heart rate variability. You wouldn't know that over 40 is like a good one, but you're like, oh, this has been tracking your heart rate variability. It hasn't been going all over the place. It's a good indicator that you don't have anything wrong with you, instead of looking at the app and being like, oh my God. And then it also can monitor your physical activity, which is so important for people in order to become healthier. So many medical conditions are caused by, obesity and not being able to work out and get things done. This can actually tell you, hey, you actually need to go and do this. You actually need to put in the exercise. Giving someone, a more measured approach to, hey, I should get out and do this. And then this, I can show you the provider portal. So although we have plans to integrate into an EHR, currently we are launching an MVP that in a couple weeks will be in an actual clinic, an actual concierge clinic. But for right now, for an MVP, we are testing in EHR integration, just how it works currently. So this basically takes the wearable data and automatically puts it into a patient's, something a provider can access, and also comes with the ability to alert the provider if there's any issue. So many people, and I actually know a couple people who this has happened to, they have had the Apple Watch was collecting data the entire time when they were going through either a heart condition, diabetes, all this stuff. It could have caught that condition before it had spiraled out of control, before they ended up in the hospital, before all of these horrible negative consequences could have happened. And that data they don't know until it's way too late. They don't know until they're going into the hospital or the ER saying, hey, my Apple Watch, it actually caught this. It actually caught this, and I didn't even know. So but there's the thing, patients don't really know. I mean, I personally open up the Apple Health app. I don't really know. I don't know what's going on. And I'm not a doctor. I am not a doctor. And that's why this is so important. It automatically takes all of this data, pushes it into a provider portal, which will be integrated with an EHR, and gives the provider AI analysis, which cuts through all of the raw data and generates, hey, maybe there's some sort of issue with HRV, blood pressure, heart rate. It gives you an idea of, hey, something might be wrong, but we want to rely on the doctor to make this final decision. So that is how the AI, of course, is helping people. It's helping providers make these decisions instead of replacing them. But again, the total you're monitoring, which ones require attention, if there's any critical status, and if there's any alerts within the past 24 hours. But at the same time, the patient doesn't need to open the app and send this. This is automatic. It automatically pulls the data from the wearable. But yeah, it gives providers a better insight on the patients. So again, incredible improvements in care, continuous monitoring, data flow, actual intelligence, reduced administrative burden. If it's integrated in EHR, you don't necessarily need to even go into a different web page. You can actually just open it up and say, hey, we got an alert. We got an alert that something might be wrong. Or it could push it to an email. Obviously, de-identified. And improves patient engagement and adherence. If you don't really need to open up the app to use it, if it automatically gets sent, you don't need to worry about pressing send every single day. That's one of the beauties of this. And then, of course, some questions. I do have some extra time, but I just want to talk about why this platform is important to me. I have had family members in the past who have had issues get out of control, and it is hard for me to know that if they were wearing this device, if they were wearing an Apple Watch where you can check your email on it, they could have prevented heart attacks, chronic kidney disease. And it's hard knowing this. It's hard knowing that this solution, although it does kind of exist fragmented in some form, it doesn't exist in the same adherence as it could have. I believe, including the founders, believe that this can save lives. And preventative care is the first step. It's the first step to preventing any illness, or at least trying to lessen it if there's no way to prevent it. But that's what's important. And we're actually partnering with a doctor to roll out in concierge clinics. Obviously, concierge clinics are exploding in popularity right now. Insurance, I'm not going to get into insurance. I don't need to. We all understand. But because concierge clinics are getting more and more popular, they are looking into preventative care. So, and that's what we're targeting, basically. That's the clinics that we are first targeting. But any questions?
Right here.
Oh, right here, right. All right, that's great.
You got to throw a little, catalyst into the crowd. I have two, actually. Is your solution currently focused on Apple Watch as the source of the data, or is there other things that work in the infrastructure as well?
Well, right now we are focusing on iOS. iOS is a huge market, and that includes the Apple Watch. We want to do integrations with Oura Ring and maybe Whoop or another wearable device, but the fact of the matter is Apple Watch is currently the most popular, and it does other things than just monitor your health. So, although we want to roll it out in the future to these platforms, right now we're focusing on the most popular demographic, which is Apple, at least in the United States.
And the second question is probably a little less techy, but a little more fundamental to the value proposition, which is the watch or any other device gathers data.
Yes.
The value proposition is the data is somehow analyzed and then fed back. And so how do we assure ourselves as consumers that the algorithms are sufficiently robust and accurate enough to give us beneficial insight? So it's not about the device, it's about the algorithms behind the device.
We actually will be working with clinicians and doctors to determine more advanced algorithm models. Right now, we're actually using one that's actually designed by the AHA, American Heart Association, to give that out and test out that trial, present it in a way that's not, not threatening, be like, hey, it's not telling them, hey, you're more likely, you're like 10% likely to develop this. It's, hey, you're in the range where everything's okay. So we are actually utilizing algorithms that have been developed by different health systems. But we have to work very closely with providers. We have to because they know more. I'm an engineer. I'm an engineer by training, and I know although I'm in biomedical engineering, I'm not a doctor. So we have to work together. We have to work together, especially with providers.
Okay.
Yes, I can.
Not really a question. I'm just looking at 2026. It's May 7th today, and we are in a very conversational age. Everybody's talking to everybody, and we're talking to stuff, and stuff talks back to us. We've gone beyond data. We've gone beyond applications. We're looking at, when we say patients and doctors, we're looking at a certain presence that we can talk to. A doctor talks to a patient talks to a doctor. So when the universe is really very conversational, someone is going to say, listen, I've seen this many, many a time. How are you set up to go to that place where the patient has a presence?
Yeah.
The provider has a presence, and they are conversing in a way which is beyond data, which is fragmented, which is beyond algorithms, super fragmented. How do you get this holistic healthcare notion, and how do we get there? I'm just wondering if anybody thought about that.
Oh, absolutely. That's why we're rolling out to concierge clinics first. They're becoming more and more popular because of that exactly. People don't want to log into my chart and see, oh, hey, this diagnostic test came back. You're in trouble, sorry. People obviously I don't too, want to see that. It's something where you're like, oh no. You're like, I've had doctors call me, they're like, your results are in. And even though I know I'm healthy and I know there's nothing, or at least I don't think there's anything wrong with me, I still have all this anxiety because my doctor didn't call me to talk about the results. They were just like, hey, it's on my chart, double check. Let's hope you understand it.
What if my chart could talk back?
Could talk back. It actually, yeah.
Any of your patients or the data could actually help.
Yeah, exactly. That's the thing. That's actually, exactly. That's more focused on concierge medicine. So
we've got time for one more.
Hi, Mia. I'm Claire.
Hey.
So your app basically collects a bunch of data. So my question is it tied to a specific condition? Like, are you looking at, let's say, patients who are diabetic or with congestive heart failure? Because if a physician receives like all this data, what are they focusing on?
So what we're trying to focus on right now, because Apple Health is actually really centered around a lot of this, is cardiovascular health first. So we're trying to start that from that angle, but of course we want to expand to chronic kidney disease, other conditions, even mental health, depending on what features we're using. So we do plan on being more specific in our early launch for cardiovascular health, but it can monitor blood oxygen and it can monitor a bunch of stuff. So it's not just focused on cardiovascular health, but that's the starting off point that we want to focus on the most initially.
Thank you.
Thank you. Oh, wait, hold on.